So we and others have obviously looked at the role of minimal residual disease testing in multiple myeloma. It's a very, very important marker for prognosis and outcome. So patients who achieve the deepest possible response as measured by next generation flow cytometry on a bone marrow specimen, or in some situations next generation sequencing, if they achieve an MRD negative status, they tend to do well overall. So, and most of those analyses are done in patients after they have completed their treatment or after stem cell transplant. So we looked at patients that how did they do if they had achieved an MRD negative status even prior to stem cell transplant. So we found about 730 patients in our database. About 300 of those had MRD positive disease, while 400 had MRD negative, even prior to transplant. And then these patients had at least achieved a very good partial response by International Myeloma Working Group criteria. And our hypothesis was that MRD negative would be associated with better outcome. And when we looked at these patients, yes, even pre-transplant MRD status was associated with outcomes of progression-free survival. So those who were MRD positive prior to transplant, fewer of them had achieved a complete remission or very good partial remission. More of them had high-risk chromosomal abnormalities, again suggesting that these patients probably had higher risk disease, had a more advanced or aggressive biology of their myeloma. But regardless, they were mostly MRD positive, and as a result, fewer of them converted to MRD negative post-transplant, and their progression-free survival was shorter. When we, on the other hand, looked at patients who were already MRD negative, more of them achieved a complete remission after transplant. More of them achieved a very good partial remission, or which they already were, but they converted it to a complete remission, and their progression-free survival and overall survival was longer. So again, we showed that MRD negative status even earlier in the course or pre-transplant is a predictor or a prognostic factor to predict the outcome of patients undergoing stem cell transplant. What should we do? Should we try to achieve MRD negative status in everyone pre-transplant? I think this abstract is more hypothesis generating from a retrospective analysis, and this is something that can be looked at prospectively in clinical trials.